कौन सा स्टार्ट कर दिया?
इसको ऊपर करना, इसको पुल करना ऊपर।
वेदा का फ़ोन कहाँ है?
इधर ही है।
वेट इसको एडजस्ट करो। हाँ पीछे जाओ। हाँ बस ठीक है।
इसको टाइट करना पड़ेगा।
ठीक है।
यार डिग्नेटरीज नहीं दिख रहे, इधर साइड वाले बिल्कुल।
यहाँ स्पीकर है ना। अरे तू कैसे करोगी?
आगे इस पब्लिक
ये नहीं होगा, ये पेमेंट गैस लाइन में नहीं गैस
ठीक है एक सेकंड।
मेरा लाइव रहेगा।
आई थिंक एक साइड से
यहाँ से
सीधा कैसे करना?
हटाएगा।
ठीक है। आई थिंक उधर वाले होंगे।
You know, 3 people have joined in and said that they can use the
while we help the individual to become mentally healthy, we also make the channel of the community as a whole.
When we look at the larger issue of mental health, there has to be a very comprehensive approach. It has to be a very multi-pronged kind of approach.
Since its inception, this foundation has responded sensitively to the needs of the people, coming up with innovative and replicable solutions.
Manas started organically. What our clients would tell us that the places that they visit are hospitalized. Sometimes people don't even make eye contact, talk to you, and that is very medically driven.
Almost by definition, working in a mental health institution has got a generalizing aspect to it. And people really like coming into the institution. So we thought it quite naturally that we have to leave the institution and go out to within the people to start our work.
Thus aiming to bring a non-delivery space for the delivery of psychological and psychiatric services. Over the years, our team has designed programs and interventions that address multiple challenges for a wide variety of beneficiaries. One key invention is the target model that helps Manas address the needs of diverse underserved communities by embedding interventions in existing systems of education, healthcare, and state-run shelters.
और किसी परिस्थिति में सकती है तो हम कैसे पहचानना है, कैसे शुरुआत करनी है और उसके बीमारी में सबके कैसे उसे नई जगह पर उसका इलाज हो जाए, वो बहुत ही तकलीफ अवस्था में आ जाए, उसके लिए सही जगह पर पहुँचे। उनके साथ अगर अच्छा माहौल मिले, अच्छा मानसिक रूप से सही भी हो सकते हैं। इंटरव्यू को करने के बाद में तो हम लोग विश्वास कर सकते हैं कि उनके मरीजों को पहचान सकते हैं और उनसे बातचीत करके उनको सही जगह पहुंचा भी सकते
You will see us as photographs in Gossam and other places. We have gone to religious temples, we have pundits who are there, we are involved in these campaigns.
Initiatives are now supported by communities thinking other unresolved another definitive step towards removing those
तो इसका कैसे हमने 64 कर दिया था तो मेरा भी चल गया नहीं तो
जब वीडियो चलेगा ठीक है।
Good afternoon, everyone. I would like to thank you all for being here with us. I would like to extend a warm welcome to all of you at the launch of the Manas National Mental Health Helpline, pioneered by Manas Foundation and empowered by AXA. Manas Foundation has been working for over 20 years towards making mental health accessible and affordable for all sections of the society. We at Manas have always believed in promoting positive mental health and well-being amongst the public, alongside preventing the occurrence of mental illness. We've been able to achieve this through our various initiatives, such as awareness campaigns to reduce social stigma associated with mental health, plugging in our mental health services into existing institutions, or building capacities of other professionals to become frontline mental health care providers. Now coming to our valued partner AXA, which is one of the largest insurance and reinsurance brands globally. They have been long-term players in the healthcare sector and have empowered an extremely successful helpline SAR for availing medical services telephonically. If we look at the current state of mental health in our country, where 6 to 7% of our population is affected by mental health disorders, and 418 suicides were reported daily in the year 2020, we feel the need for making mental health services accessible to all is imminent. Keeping this need in mind, both these organizations have now come together with a shared vision of making mental health services available to everyone across the country. We've come together to launch a 24/7 mental health helpline, and anyone who calls this helpline will be able to seek professional support for common and serious mental health concerns from trained and qualified psychologists. This is the first of its kind helpline, which is supported solely by expert psychologists who are there to provide you with assistance at any time of the day. Please join me for a round of applause to congratulate AXA and Manas Foundation for this initiative. On that note, I would like to invite Mr. CEO AXA France B India Reinsurance Branch, to share his thoughts about this initiative and his vision behind promoting holistic healthcare for all.
First of all, thank you for Manas Foundation for partnering with us for this helpline, and thank you for everyone being part of it and for coming for this launch. So mental health is one of the key topics nowadays that you hear in the newspaper, and this was a topic that people like me used to laugh about it 2-3 years back, because it was a taboo. We thought that it's for the pampered generation. Some of my colleagues, they have heard that thing many times, till it hit us quite close to home. In our office, family and friends really made us feel that this is serious. This is something that's there. Then when you have any illness, you hope that you have insurance cover that provides you that protection. Our regulators told us, the government has told us, but as an industry we don't do it. And the reason is we don't provide primary care in India for our patient. And in this case, we don't understand the subject. We don't have enough data. So we don't even provide hospital admission. If you're smart and you work for a good corporate, you might get some money out of us, but normally we don't. So how do you cover this topic? What is required in mental health? Mental health is a huge subject in itself, and it's something that we are learning ourselves. And I think first what we figured out was that people should have access to a helpline where you can call to understand whether you need mental health therapy or you need just someone to talk to. Can the psychologist help you? And can you maintain confidentiality? I don't want anyone to know that I'm using the helpline. So most people might call in the night. Some people might call in the day. So our idea was that, okay, let's do two things. First, let's launch this helpline to understand how this thing works. Let's provide help to people who need it. And let's do it with an organization which knows this subject very well, and Manas Foundation and pioneer in this. So that gave us a lot of confidence in that. And then we wanted to make it 24/7. And for this helpline, what we believe is it will evolve. Our previous helpline on telemedicine, which is running across the country, that has also evolved. And that will evolve on feedback. If you think we need psychiatrists, we'll add psychiatrists to it. If you think you need people from different languages to speak, you want male or female call, we'll add. It has to adapt because we want people to use it. This is not an insurance helpline that I make money if you don't call. I'm not going to make any money out of it. So please call, and that's the entire idea. And we are taking this as a group as a very serious issue, mental health. We are one of the first groups globally which has provided mental health protection to our employees. It's not insurance cover, it's a mental health helpline and mental health therapy and all those things we are providing to all our employees. It's a serious issue for us. And EXA has taken a lead position in providing a mental health cover. In India, when you go to an insurance company, you tell them the mental health is why it's not covered. They say there's no reinsurance. It's easy to blame the reinsurer because we don't know where we are. So it's easy to blame the reinsurer. So what we have done in India is we have launched a specific capacity. And we launched the first mental health cover in India, which is 25,000 therapy, 1 lakh hospitalization. I know it's not enough. But in the end, we don't have data, so we're gambling to a degree. But we have launched it for the group clients. I hope that over a period of time, with participation from people, interacting with more people, we have enough data so that we can offer this to everyone. That it's part of the normal policy. In EXA, our belief is that right now, when you think of insurance, you don't think of us in a great manner because you remember us when there's a claim, and it's not a great time to feel. We want to change that. We want to bring service before risk transfer. We want to be part of you in good days also. We can give you some other benefits also. You don't only have to come with claims. So we're trying to change the way normally insurance companies work, especially the way we have worked previously. Mental health, I don't know how long this helpline is required, but if it requires for a longer time, we'll try to see this running out there. And please give us feedback. Please tell us what we are doing wrong, guide us. And we want to learn from all of you who are on this, and we want to make it a success. And again, thank you for joining us today on this launch. And also our Asia and Gordon is there. So, and Gordon is a big supporter of this topic. He's someone who's a pioneer in the Asia region and Africa region on this mental health as a project. Thank you.
I would like to thank God for talking about the two aspects of mental health which are extremely important. That's confidentiality and anonymity. A lot of people are scared to call up a mental health professional just because they are scared that their name will be revealed, or what will people talk about, how will people talk about them, and the social stigma that will be associated and attached to them. So I think this helpline offers that place where people can feel safe and talk about their concerns without their name being revealed or without their physical presence. So I think that was really, really important. I would now like to invite Manas Foundation's Managing Trustee, Ashoka Fellow, Ms. Monica Kumar, to come on the stage and talk about how the idea of this helpline was conceived.
Good afternoon. Here Mr. Watson, Mr. Javan, Shazia, who's here to join us, Fazia, Raj, Dr. Danish, Rana, and Yaswinder and Anuba partners, everybody who's present here. It's a great honor and privilege to be here today and talking about something which is very dear to me. I grew up, if somebody asks my identity today, it is mental health. But, I'm going to start this on a little uncomfortable note. We sent our team member, who's also answering today, Veda, to Gwalior. And it was to do a need assessment. And, she went there, and there's an organization which is working in mental health care. And they asked her, when she did the need assessment, they found out there are 900 suicides in 3 years. There are suicide points all over Gwalior. The police doesn't know how to manage that. The people don't know what is happening. Whether it is a learned phenomena, is it something that people are uncomfortable about? Is it something that is not talked about? Is mental health overdiagnosed, underdiagnosed? Is it just, and the issues are very minimal. मेरी साड़ी नहीं अच्छी मिली, my husband didn't buy me a good sari and somebody committed suicide. I didn't get marks in the board exams, somebody commits suicide. Now we as mental health professionals understand, and that's where I'm coming from, that suicide is not an event. It happens because there is a lot of thought behind it. There are other red flags which have been coming off and on. But it's just the suicide people say, and say, but minimal sa karan tha aur suicide kar liya, right? So that's one thing I wanted to bring you to everybody's notice. Mental health is real. It is something which is impacting all of us. We are all experiencing it, and we as institutions, we as people need to do something about it. The second thing, which actually I was speaking to Mr. Javan right now, and when I was thinking, and we were talking about insurance and mental health and all the other things which are happening, and we realized that, all right, last 2 years have gone in pandemic. Okay, our bodies and minds is gone through a lot, but currently we are living in a pandemic of fear. We are actually, every message, every communication, everything outside is on a fear. Everything is telling us you need to be fearful, and fear is the genesis of mental health issues, be it anxiety, be it depression. We are sold fear. and we, and it totally depends upon your resilience. If you're resilient, you will overcome it. If when it hits you, but it will hit you one day. At what age it will hit you, but it will hit you because you get fearful and then the whole cycle starts. Now, WHO tells us that mental health is something, there is no health without mental health. But what is the delivery system of mental health? I mean, if you look at it, the needs of people is very different, and the delivery system that we have is very different. People want to come and talk about things. People want to say that, this is happening to me. Is it mental health? There is a Google across available. Everybody wants to read up on Google and say that, okay, I have a diagnosis, but do we have a language? Is it easy? I mean, as far as heart disease is concerned, as well as non-communicable diseases have come, we have come a long way. But when it comes to mental health, we are still at a very nascent stage where we are all understanding, we are all figuring out what is happening to us. Is it fear? Is it anxiety? Is it panic? Or is it actually that I have a heart problem? So, there are a lot of thoughts in and around it. And we, when we started Manas, the idea was to give I have a vision statement, I'm going to read that out. No matter how hard I try to remember the vision statement, which took us 3 days to create, I always have a problem with that. The aim of creating and promoting inclusive communities which are mentally healthy, equal and empathetic to all. That is what Manas. There were a couple of thoughts behind creating Manas, and one of them was that we will not, we decided what we will not do. We will not create institutions, because there was enough institutions in and around who were catering to, serious mental illness. They were catering to, government also gave funding only for creating institutions, and we said we are not going to do that. We said we are going to talk about common mental health disorders, because WHO said, when we started 20 years back, they said 2020, the biggest problem and biggest thing that we'll be dealing with is depression, and so we are, and pandemic hasn't helped. We also said that we will look at not the medical model, but look at the psychosocial model. What do we do that people feel open, people feel encouraged, people have empathetic environment, that people can come and talk about it and don't feel judged. That it's okay. I'm not weak because I have mental health issues. I'm not weak because I'm depressed. It's normal. Like, we normalize the language of mental health, and that was the idea. And then, when we went for funding and we went across, they said, "Aap serious mental illness where you don't work, there is no funding," because most pharmaceutical would like to see serious mental illness as a backdrop of funding. So we said we will continue to work in mental health, we will not work in education, we will not work in poverty, and one day the change will come. And that was, I was telling Mr. Nijawan, that insurance of mental health is we've been talking about it. I know how much our clients go through, because there is a very high morbidity and very low mortality. So the burden on the family member is very high. But the idea that somebody is thinking of insurance, it may take 5 years, but hang in, and it will be the most talked about thing at one point. So, we all know that there are very few trained people, so we trained people. We kept on organically involved because we were mental health professionals. We didn't have trainings in NGO, running an NGO, but whatever the need came, we went ahead and we decided to, take hold of that need, and we trained people. We partnered with other institutions, and we embedded mental health as a part of their critical intervention. So we did not create another institutions, we just embedded mental health. in their interventions. So currently we are working in various locations. We have a very unique model of mental health care in WCT, where we are providing mental health services to all the people who go to the custodial care settings in Delhi and NCR. We are with the Tribal Welfare Department and with UNICEF in Chhattisgarh. We are in Dausa, we are in Banaras. So we are taking mental health to last mile connectivity. I know accessibility and affordability has always been a challenge for mental health because it's like a long route with no end. That's how people see it. एक बार mental health professional के पास गया तो फिर it is a never-ending phenomenon. So we are really grateful to AXA for understanding mental health needs are important and being our partners. So, when people come for counseling, not only can we tell them that what is the actual issue, is it something serious or is it just one of those concerns which can be dealt with and you move on with your life. But, to not have resources to come up to that is a huge challenge, and thank you very much for giving us that opportunity. Thank you.
Thank you so much, Monica ma'am, for those reflections. And I would also like to add that what ma'am said about the fact that we use the psychosocial approach is so very important, because a lot of times we medicalize mental health concerns and a lot of people shy away from seeking help. So it's extremely important to understand it as a psychosocial concern rather than just a medical concern, and label people with mental health disorders. With that, we now have Mr. Arjun Ram Meghwal, Honorable Minister of State in the Ministry of Parliamentary Affairs of India, addressing us virtually on how the pandemic in the last 2 years has impacted the mental health of people globally, and how having this mental health helpline for all is the need of the hour.
मानस फाउंडेशन द्वारा 10 मई को एक कार्यक्रम आयोजित किया जा रहा है, जिसमें मनोवैज्ञानिक सलाह और इसी तरह से जुड़ी हुई जो एक हेल्पलाइन है उसको शुरू करने का कार्यक्रम हाथ में लिया है। देखिए, कोविड-19 के बाद देश और दुनिया में अवसाद की घटनाएं भी बढ़ी है। कुछ लोग अकेलापन भी महसूस कर रहे हैं। ऐसी परिस्थिति में मानस फाउंडेशन का कार्य सराहनीय है। मैं इनके जो सीईओ हैं उनको बधाई देता हूं, शुभकामना देता हूं, अंकुर जी को और उनकी पूरी टीम। ये कार्यक्रम शुभ हो, सफल हो, ऐसी शुभकामनाएं देता हूं। बहुत बहुत धन्यवाद।
Thank you so much, sir, for all the good wishes. On that note, I would like to invite Mr. Gordon Watson, CEO AXA Asia and Africa, to virtually share with us his valuable perspective on the importance and the need for mental health services for all. I would like to invite Mr. Gordon Watson, CEO AXA virtually share with us his valuable perspective on the importance and the need for mental health services for all.
Hello, can you hear me?
Yes, we can hear you.
Anchor, can you hear me? Can you raise your hand if you can hear me? I can. Wonderful. I can't hear anything, but first of all, let me go ahead and Anchor, if you just raise your hand if you can hear me. So first of all, thank you, Anchor, and thank you, Monica. I'm hugely privileged and honoured to be here at the launch of the Manas Mental Health Helpline and talk to you about the importance of mental health. As Monica and the WHO said, there really is no health without mental health. 1 in 4 people will suffer mental, neurological, or a substance abuse disorder at some point in their life, but many cannot get access to basic medicines or even basic health care. Depression is one of the leading causes of disability, and suicide, unfortunately, is the 4th leading cause of death among 15 to 29-year-olds globally. People with severe mental health conditions die prematurely, as much as 2 decades early, due to preventable physical conditions. Now, what is mental health? Mental health really is an invisible disease, and it's a disorder of thinking, of feeling, and perception. There is a strong relationship between mental health and well-being, and good mental health is important for achieving this high level of well-being that we all want to achieve. Comorbidities with physical health, when you have physical and mental health problems together, are twice as likely to have poor mental health conditions, which may even worsen the physical condition. So the physical and mental health are very, very much interrelated. Now, we as an insurer at AXA, we're determined to make this invisible disease much more visible, giving a strong focus to mental health, and in particular in the workforce, through research and through solutions. Through the past 2 years, it's been extremely difficult due to the pandemic, but our research has been very clear. COVID actually has been, in some ways, a silver lining, not for mental health, but for the awareness of mental health and how important it is to all of us, and why increased resilience in the face of adversity is so important. Now, we have done a lot of surveys, and actually, interesting enough, because we have the US, we have Europe, we have Asia. More people in Asia, 42%, said that the pandemic had improved their ability to meet big challenges, more so than European people, which was at 33%. And actually in China, 68% of the people said that was the case, and compared to 41% in Hong Kong and 17% in Japan. So you can see this, even within Asia, this massive difference in the way people feel about things during the pandemic. So what we did a lot of quantitative and qualitative research, and respondents were classified into 4 mind health. We use mind health rather than mental health. We think it's a more positive term. So there are 4 mind health states. One is flourishing, then getting by, then languishing, and then struggling. And flourishing clearly refers to the pinnacle of mind health, and getting by describes those who have some areas of good well-being but not enough to reach out, as you can see, the state of flourishing. And languishing represents the absence of positive well-being, and struggling is really the lowest, where people really are struggling with emotional stress and psychosocial impairment. So globally, about 32%, about 1/3 of the people globally are just getting by, with only 24% flourishing. But you can see there's a massive, more than, close to half of the people really are not doing well. And this gap is wider when examining each region, with only 20% of Asia flourishing versus 25% in Europe, and 35% getting by in Asia compared to 32% in Europe. So you can see those who are languishing or those who are struggling, is about roughly 40%. So with these findings, we already knew this was the case, but this is science-backed research, and we can really see the real need for mental health or mind health as solutions. It's a bigger disease burden than physical health globally. Absenteeism is easy to measure from work, but the workplace is losing productivity also because of presenteeism, where people are there but they're really not showing up. So we've introduced solutions such as mind health teleconsultation on Emma, which is an avatar. We can use real people, we can use services, but we can also use artificial intelligence. We're looking, actually it's not quite mind health, but in terms of Alzheimer's, we've worked with Professor Kawashima, who's one of the inventors of Nintendo, for mind games, and we've had an amazing uptake in people really working on these brain training games to really improve and stave off Alzheimer's, dementia, etc. Although that's much more physical. The other area that we're working on, we're working with Columbia University on One Mind, which is one of the largest NGOs, global NGOs for mind health, on an index for corporations, so that corporations really can understand where they are against the best practices to provide the best psychological safe spaces in their environments, create the correct culture for well-being, so they can see, hey, this is a best practice, this is where we stack against it. And if we can index that, it's a very good way of us, when you're a business person, quite often you want to measure things and you want to see things in numbers, etc. And when you just talk about mental health or mind health, it's invisible and there's nothing to really calibrate it. So this will help us calibrate this, and it will show CFOs, it will show CEOs why this is so important, because there's so much lost productivity, but at the same time it's the right thing to do. So we think this could be a big breakthrough. So finally, I'm hugely honoured and so happy to see that AXA and Manas get together to really produce this 24/7 mental health helpline, and really, to make a difference in the lives of the mental health and the people of India. So thank you very much for giving us this opportunity, and I wish everyone, I wish I could be in India, and unfortunately I can't travel at the moment, but all the very best and much success for the future and the launch of the helpline. Thank you so much.
Thank you so much, Mr. Watson, that you joined us today for this event. It's actually quite amazing to see the kind of surveys and the research that has been done at your level. We hope to do something in India also. Thank you so much. We're grateful that you could join us today for this event.
Thank you very much indeed.
Sir gave a very nice global health perspective to all of us for understanding mental health and all the statistics that are related to it. Now let us spend some time listening to a few of the endorsements from our allies and supporters who've been pioneers, creators and innovators in their respective fields.
नमस्कार। हम इससे ज़्यादातर लोग अब ये तो समझने लगे हैं कि हमारी फिजिकल हेल्थ के साथ साथ हमारी मेंटल हेल्थ भी उतनी ही ज़रूरी है, लेकिन अब भी हम इससे ज़्यादातर लोग ये नहीं समझ पाते कि कब हमारी मेंटल हेल्थ को केयर की ज़रूरत है, कि हम क्या करें, किसके पास जाएं। मानस फाउंडेशन या टीम मानस फाउंडेशन मेरे लिए हमेशा एक परिवार की तरह रही है, and I know the wonderful work that this team is doing in the field of mental health। और अब मुझे बहुत खुशी है कि मानस फाउंडेशन और एक्सा मिलकर ये एक इनिशिएटिव, एक कैंपेन शुरू कर रहे हैं जहां बहुत सारे लोगों को मदद मिल पाएगी, जिन्हें मेंटल हेल्थ की देखभाल की ज़रूरत है या वो नहीं समझ पा रहे हैं, या इट विल आल्सो हेल्प टू स्प्रेड अवेयरनेस about mental health. So I really wish Team Manas Foundation all the best. My best wishes are always with you. Namaskar.
Good evening. During and after this COVID pandemic, many people have started taking care of their physical health. Our mental health also needs equal attention, if not more. Often, people do not know whom to reach out to. More awareness around mental health is the need of the day. Congratulations to Manas and AXA for initiating a national mental health helpline. I repeat, a national mental health helpline, and this is free of cost. A brilliant initiative. For any mental health queries, please call 080-6909-6909. I repeat, 080-6909-6909. Thank you.
That was an address by Dr. Padma Bandyopadhyay, the first woman Air Marshal and Padma Shri awardee, a very close supporter and ally of Manas.
Physical health and mental health both are extremely important. We work a lot on our physical health, but not so much on our mental health. I would like to congratulate Manas and AXA for bringing together a collaboration, providing these health services. So go out there, use them, if at all you need to get better. We all need to get better. Congratulations, Manas and AXA.
That was an address by Anju Chopra, Padma Shri awardee and former India women's cricket team captain. I would now like to request our special guest, Ms. Fauzia Dastano, a renowned artist and storyteller, to come up on stage and share a few beautiful pieces from her work.
सबसे पहले तो मैं मुबारकबाद देना चाहूँगी मानस को इतना बेहतरीन काम करने के लिए। और सबसे इम्पोर्टेंट बात ये है कि ख़ासतौर से ये वक्त की डिमांड है, ये आज के वक्त की डिमांड है कि ऐसी कोई हेल्पलाइन हो जहाँ पर हम जब एक घबराहट हो और हमें डर लगे तो हमारे पास कोई होना चाहिए जिससे हम बात कर सकें। मैंने हमेशा कहा है कि हम शुगर की गोली रोज़ खा सकते हैं, हम थायराइड की गोली रोज़ खा सकते हैं, लेकिन अगर हम मेंटल हेल्थ से रिलेटेड कोई गोली खाते हैं तो हमें शर्म आती है। लोग कहते हैं पागल है क्या। तो ये जो एक मिथ है पागल है क्या, इसको दूर करने के लिए मानस काम कर रहा है। और मैं आज इस प्लेटफॉर्म से एक बात और कहना चाहूँगी, पिछले 2 साल से मैं और मानस रेड एफएम हमें प्लेटफॉर्म देने के लिए तैयार है एक पॉडकास्ट के लिए, और हम पिछले 2 साल से एक पॉडकास्ट करना चाह रहे हैं मेंटल हेल्थ को लेके, लेकिन हमें इसके लिए कोई स्पॉन्सर नहीं है। मजे की बात यह है, मेरा एक और पॉडकास्ट है दास्तान बॉलीवुड जो मैं करती हूँ, उसके लिए आपको स्पॉन्सर मिल जाते हैं, मगर जब आप मेंटल हेल्थ पे कोई पॉडकास्ट करना चाहते हैं तो उसके लिए मुश्किल से स्पॉन्सर मिलते हैं। तो आज मोनिका की ही बात को और जितने भी लोगों ने मौजूद हमारे मेहमान यहाँ मौजूद हैं उनकी बात को आगे बढ़ाते हुए मैं असल में उन्हीं की बात कुछ पोइट्री में कहना चाहूँगी, जिसको लिखा है मानवी कटोच। एक बार पूछकर तो देखो, एक बार पूछकर तो देखो, क्या पता वो अपने दिल का दर्द बता दे। एक बार फिर रुककर तो देखो, क्या पता वो खुद से अपनी नाराजगी की वजह बता दे। दिमाग का फतूर, दिल का वहम, उदास रहने की आदत, ध्यान खींचने की चाह, उसके माथे से ये टैग हटाकर तो देखो, क्या पता वो भी खुदकुशी का ख्याल अपने दिल से हटा दे, अपने दिल से हटा दे, अपने दिल से हटा दे। तो जो मोनिका यहाँ बात कर रही थी, एक बार पूछ कर तो देखो, उसी को जब हम ये बात कहानी के जरिए बात करते हैं, हम पोइट्री के जरिए बात करते हैं, तो मुझे ऐसा लगता है जैसे काफ़ी बार लोग कहते हैं ना यार ज्ञान मत दे। जब भी हम मेंटल हेल्थ पे बात करते हैं तो मैंने बहुत देखा है भाई ज्ञान मत दो, लेकिन जब आप पोइट्री या कहानी के जरिए कोई बात करते हैं तो हर एक को लगता है अरे ये तो मेरी बात हो रही है, ये तो मेरी कहानी है, इससे तो मैं गुजरी हूँ। तो उसी को आज की मेरी आखिरी पेशकश, और ये में छोटे छोटे इमोशंस हैं, जो घटनाएं हैं बेसिकली छोटी छोटी जो घर में घटती हैं, उसको मैं एक्सप्रेस करने की कोशिश करूँगी। इसको लिखा है शेफाली ने। सुनो, मुझे अच्छा नहीं लग रहा, इतना घुमा फिरा कर बोलने की क्या जरूरत है, अरे मायके जाना है तो सीधे बोलो। नहीं नहीं, मैं ये नहीं कह रही थी। फिर वो कुछ कह नहीं पाई। भीगे तकिए को मालूम होगी क्या उसकी अचानक से बुझ जाने की हर वजह। दूसरी घटना, प्लीज रोशनी मत करो, घबराहट होती है। तुम्हें ख्याल है तुम कर क्या रही हो? अरे बच्चों पर क्या असर पड़ेगा इसका? सुनो तो, मुझे रोना है बहुत जोर से। अरे जाओ उधर जाओ, अरे बाहर दरवाजे पर और चीख के और पूरे मोहल्ले को सुना कर रो, यहाँ ये नौटंकी मत करो। वो छत के अंधेरे कोने में आसमान से पूछती रही, मुझे इतना रोना क्यों आ रहा है? तीसरी घटना, एक मिनट का टाइम हुआ क्या? मेरी बात सुन ले यार, डर लग रहा है। किससे? क्यों डर लग रहा है? यार तू ऐसा बोले कि बोल्ड बन, बोल्ड यार। अरे उस पर सोच नहीं करता ये। वो कई दिन तक बाथरूम में बड़बड़ाती रही, दुनिया से अनसुनी हो गई हो। कोई सुन लेता कि सुनना प्रेम की सबसे जरूरी प्रक्रिया है। तो यही सब सुनने के लिए मानस एक हेल्पलाइन लॉन्च कर रहा है और वो सुनने के लिए तैयार हैं। बात यह है कि आप हम सुनाने के लिए तैयार हैं। बहुत बहुत शुक्रिया।
फौजिया मैम, बिल्कुल दिल को छू जाने वाली आपने पोएम शेयर करी हमारे साथ। I genuinely believe that sciences are necessary for the growth and sustenance of this human civilization, but art is necessary for our soul. I now request our expert guest, Dr. Danish Ahmed, Senior Psychiatrist, Max Hospital, Delhi, to join us on stage and share his insights from the clinical point of view with respect to providing mental health first aid and how it can be effectively implemented.
Good afternoon to all of you. It's a privilege to be here. So, I would like to start this by sharing with you a few of my own experiences and by learning from the learning that I've had from the patients. So the most important thing is there. The funny part of medical science is that everything is insured except the brain. All the body parts are insured. Your health is insured, your physical health is insured. If you see any changes in the MRI and if you have a stroke, everything is insured except if it's a mental illness, because it's not going to be seen on the reports. You are not going to have it on the MRI, you are not going to have it in the CT scan. And if there are drugs in the body, then you have taken the drugs yourself. So it is your concern, it is your problem, you are supposed to deal with it. The concept that this is an illness and people are affected by it is just not there, and if it is there, it is not accepted. See, as a child when I started, I used to stammer a lot. I still stammer a lot, and I used to be an anxiety patient myself. So now, being a psychiatrist, I have learned how to deal with all these things. I suffered from very severe bout of depression myself in school, and at that point of time, I remember कि I was looking कि मुझे कोई मिल जाए बात करने के लिए, किसी से मैं अपनी चीज़ को शेयर करूँ या कुछ और करूँ, लेकिन उस टाइम कोई अवेलेबिलिटी थी नहीं। उस टाइम तो I wish मैं जैसे स्कूल के अंदर एकदम चुपचाप बैठा रहता था, एकदम शांत, एकदम चुप, एकदम सीधा सा। तो मैम आके मेरे से पूछते हैं कि क्या हुआ, तुम बड़े परेशान हो? मैंने बोला नहीं मैम ठीक है सर, चलो ठीक है, हो गया। Performance was dipping, the child was failing, everything was being done, but किसी ने कुछ पूछा नहीं कि भाई क्या हो गया, क्यों परेशान हो। I hope कि उस टाइम मोनिका थी होती, मैं उनको फोन करता, बोलता कि यार मैम just help me out but everything। इतनी सीवियर मुझे एंजाइटी उस टाइम होती थी कि अगर मैं उस टाइम भी स्कूल की बात है, यू नो, उसके बाद एमबीए स्टार्ट हो गया, एवरीथिंग वाज फाइन, यू नो, हॉस्टल लाइफ, मस्ती मजाक सब कुछ ठीक ठाक चल रहा है। उसके बाद जैसे ही पीजी लाइफ स्टार्ट हुई, पीजी के एग्जाम निकालना एक बड़ा टास्क, ठीक है। उसमें इतनी सिवियर एंजाइटी, पूरा साल पढ़ाई की मैंने, आराम से पढ़ाई करी, 15-20 दिन पहले एग्जाम से परफॉर्मेंस एंजाइटी होगा, इतनी सिवियर एंजाइटी कि आई वाज नॉट एबल टू स्टडी एनीथिंग, एकदम माइंड बॉडी पैरालाइज्ड। मैं पार्क में जाके पढ़ाई कर रहा हूँ, कहीं जाके पढ़ाई कर रहा हूँ कि कहीं यहाँ फोकस आए कुछ हो, लेकिन हुई नहीं। सी व्हाट हैपेंस इज दैट मेंटल हेल्थ में, इफ इट इज नॉट अ वेरी सीरियस मेंटल हेल्थ इशू, जो झेल रहा होता है उसी को करना, ठीक है। I'll tell you an example, and same thing, when I tried to sort it out, I took some help, it was all completely fine. You know, exam भी निकल गया, anxiety भी खत्म हो गई, standing पर भी control आ गया, everything was okay. So once you know, and once you seek help, see, you are suffering from it because you are not able to cope yourself. Now, how are you going to learn yourself? If you are suffering from it because in the first place you are not able to cope with it. How are you going to automatically learn? If you learn, well and good. If you are not able to learn, there should be something, there should be a focal point where you can go and seek help. So this is, see, I just give you a simple example. This is how mental health can affect your own performance, your anxiety, and can do, you know, and can screw up your professional life, your personal life, and your performance obviously. Now I will tell you another example how it can affect your physical health also. So I had a patient in the hospital in Max only. So he came with gastric issues, you know, recurrent hiccups, acidity, not responding to anything, endoscopy हो गई, colonoscopy हो गई, CT scan हो गया, हमारे सब सारी इन्वेस्टिगेशन करके डॉक्टर जो गैस्ट्रो वाले उन्होंने हाथ जोड़ के बोला भाई मेरे मैंने सब इन्वेस्टिगेट कर दिया, and he had serious hiccups. देखिए आप बोल नहीं पाओगे कि एक्चुअली में कोई इनके साथ कोई फिजिकल दिक्कत आपको लगे, फिजिकल ही दिक्कत कुछ नहीं। So when I went to that patient, you know, and he was saying कि कोई स्ट्रेस नहीं हुई लाइफ में, कुछ नहीं है, सब कुछ ठीक ठाक है, and he was so stressed out. He said, you know, I've been suffering from this for the last 2 months now. अगर ये ठीक नहीं हुआ, I'll commit suicide. I can see the fan. I'm not going to live like this. Okay? So, you know, I reassured him, counseled him, it's okay, it can happen. I just gave him a simple anti-anxiety clonazepam, that's it. मैंने बोला आप पहले ही और थोड़ा सा माइंड रिलैक्स हो। 4 घंटे बाद जब मैं आया तो ही वाज लाइक, अरे आप तो भगवान, आपने क्या क्या कर दिया, कुछ कर दिया, मैं एकदम ठीक हो गया, सब कुछ हो गया। We put him on other medications also, but this is how severe the anxiety was. This is how the gut-brain axis was playing on his brain, and he had become actually suicidal. He was under extreme stress. And since that day, he was like, आपको पता नहीं हमारे लिए क्या कर दिया, मुझे पता था क्या किया, सिर्फ anti-anxiety पिल दिया और कुछ नहीं किया। Counseled him, reassured him, and he was completely okay. See, and then there are serious mental health illnesses. Okay, like schizophrenia, like bipolar disorder, you know, other kind of the spectrum, like OCD and everything. Addiction itself, now the evidence is that, you know, addiction itself, it is neurobiological in nature, it is genetic in nature. You know, everybody drinks, but everybody is not going to become an addict. Most school-going kids, most college-going kids, they take hash, but everybody is not going to land up in a rehab. Okay? Now there is something else happening socially, genetically, psychologically, that they are landing up in a bad state, that they have to take a bottle of alcohol, and the other ones, they just suffice with a drink of alcohol. You know, so there is a definite psychosocial role, there is a definite genetic role in all these things. Okay, and if there is an illness, there are supposed to be doctors for that, and to help the patient out, there is supposed to be a mental health helpline, which is the need of the hour, because the total number of psychiatrists in India are only around 9,000. You know, the requirement of 9,000 was there in 2002. Now, अब ये 9,000 requirement, at that point of time there were just 3,500 psychiatrists in India. अब ये requirement पर हम लोग आए, right? There's 0.75 psychiatrists, less than 1 psychiatrist for 100,000 people. Okay, and the same goes for the psychologists and clinical psychologists and the counseling psychologists. So we do not have the adequate manpower to deal with all these things and to see everybody in person. There needs to be a mental health helpline where screening can be done, where the required counseling, the required support structure can be given to the patients right there, right now. Okay, and then they can screen whether you need some serious help or only therapy is going to suffice for you or you require some admission. Till that, and this is the psychological first aid that is required for everybody. That is required for everybody. And we have a huge population to cover. I do not see any reason why it should not work out. Any reason why it should not work out at all. It is 100% it is going to work out, and you are going to flood it with calls. It's only if people know. It's how if people know, they'll approach you. If they don't know, only they are not going to be able to approach you. So your reach is supposed to be something which could be pan-India, which everybody knows, and I assure you that it is obviously definitely going to see the same exam stress that I was going through, exam anxiety or depression due to my interpersonal issues and everything. I see every day in my OPD 3 to 4 kids suffering with the same stress, and all of them doing well in life. After they take help, after they are able to do, after they get some good professional help, the same stress, the more the families become nuclear, the more the need is going to arise for all these things. The parents are not going to be trained how to, how to make the children, they are not going to be, first of all, they are going to have adjustment issues themselves in this fast-paced life. Okay. And then children are not going, they cannot teach the children also. So there needs to be some program which is holistic in nature, which can help them deal with all these things. These things are just going to increase from here on. And then there is always a confusion, is it real or is it not real? See, anything which is stressing you out is real. Anything, if you are not able to deal with the stress, is real. Okay, now it can be something very mild, which can be taken care of. It can be very severe, which needs some more help. It can be very severe, which needs help plus medications, or it can be something at the end of the spectrum where you require some institutional help, or you need to be taken to a place where you need to get it. And most illnesses, most illnesses arising out of lifestyle, arising out of coping mechanisms, arising out of family issues, interpersonal issues, they respond very well to good professional help. And they're completely okay. Serious things is different thing. It is just as if what the common stigma, the common doubt in everybody's mind is that, doctor के पास गए पागल हो गया, right? Problem है कि जब हम किसी physician के पास जाते हैं, right? हर इंसान को बुखार के साथ जा रहा है, with mild cough, with fever, we don't label them कि डॉक्टर के पास जा कैंसर हो गया. लेकिन मेंटल हेल्थ प्रोफेशनल के पास डॉक्टर के पास गए डायरेक्ट खत्म लेकिन we need to destigmatize these things because as I said any stress is real. Stress is real. जो झेल रहा होता है उसी को पता होता है. The one who's going through it only knows about it. So there is a huge there is a huge infrastructure gap. Now we can't create the infrastructure in a few years. What has not been done in the last 7 years is not going to be done now also in the next 4-5 years. We can't do that. So we need to be more innovative in our approach as to how to deal with these issues with the current manpower. What can we do, right, to bridge the gap? And this is very, very important. It is going to be of a huge boon to patients. I have seen people calling me up from villages and they don't have access to anybody even to talk to in the next 200 kilometers. All that they require is to listen to them, help them out professionally, try to ease things out for them. Everybody has got their own difficulties in life. If everybody is 10-20% plus minus, everybody has got their own share of difficulties. There is going to be nobody who's going to be completely happy and completely fine. That's going to be a one in one row. Everybody at that point of time requires help. Some at 18 years of age, some at 10 years of age, some at 40, some at 60. But help is required. Okay. So it's a good initiative, it's a great initiative. I hope it works out very well for all of us. Thank you.
Thank you so much, sir, for sharing your personal anecdotes with mental health and your clinical practice with us. And I think you were brilliantly summarizing your learnings and insights over the past past years for us. We're just going to watch a short video now of Manas's journey in the mental health sector and all the things that we've learned so far during this journey.
To work for the cause of creating mentally healthy communities is an endeavor riddled with varied challenges. Challenges that have helped Manas Foundation develop a unique perspective towards the mental health needs of our country.
Mental health is generally associated with an individual. So while we help the individual to become mentally healthy, we also take the channel of the community as a whole.
When we look at the larger issue of mental health, there has to be a very comprehensive approach. It has to be a very multi-pronged kind of a model.
Since its inception, Manas Foundation has responded sensitively to the needs of the people, coming up with innovative and replicable solutions.
Manas started organically. All our clients would tell us that the places that they visit are hospitalized. Sometimes people don't even make eye contact when they talk to you, and it is very medically driven.
Almost by definition, working in a mental health institution has got a stigmatizing aspect to it, and people don't like coming into the institution. So we thought it but natural that we have to leave the institution and go out to within the people to start our work.
Thus came into being a non-clinical space for the delivery of psychological and psychiatric services. Over the years, our team has designed programs and interventions that address multiple challenges for a wide variety of beneficiaries. One key invention is the plug-in model that helps Manas address the needs of diverse underserved communities by embedding interventions in existing systems of education, healthcare, and state-run shelter homes. In 2018, Manas began work in Dausa, a small town in Rajasthan, putting into action its multidimensional approach, working along with 3 government departments in the district.
इसमें अलग-अलग चीजें बताई जो मैंने पहली बार सुनी है। आज मैंने बैलेंस सीखा कि अपन को गुस्सा कंट्रोल करना चाहिए, किसी को मतलब ज़्यादा चिड़चिड़ा कम होना चाहिए, ऐसे होना चाहिए और सबके साथ हैप्पी होना चाहिए। मैम ने बोला कि आपके फीलिंग्स जो भी है, जो आप फ्रेंड्स को नहीं बता सकते, मम्मी पापा को नहीं बता सकते, टीचर को नहीं बता सकते, तो आप हमें बताओ, हम आपके फ्रेंड की तरह ही है बिल्कुल। मानसिक बीमारी ऐसी है जो किसी भी व्यक्ति को कभी भी हो सकती है, किसी भी उम्र में हो सकती है और किसी भी परिस्थिति में हो सकती है। तो हम कैसे उस मानसिक रोगी को अपने क्षेत्र में पहचानना है, कैसे उससे बात करनी है और उसकी बीमारी को समझ के कैसे उसे एक सही जगह पर जहाँ पर उसका इलाज हो जाए, वो वापस अपने पूर्व अवस्था में आ जाए, उसके लिए उसको सही जगह पर भेजना है। उनके साथ अगर अच्छा माहौल बिहेव उनको मिले, अच्छा मानसिक रोगियों को, तो वो सही भी हो सकते हैं। इस ट्रेनिंग को करने के बाद में तो हम पूर्ण विश्वास से कह सकते हैं कि फिर भी मरीजों को पहचान सकते हैं और उनसे बातचीत करके उनको सही जगह पहुंचा भी सकते हैं।
हमारे एरिया में मानस फाउंडेशन हमारे साथ मिलकर काम कर रहे हैं, उससे हमारे एरिया में काफ़ी प्रोग्रेस हुआ है इन बीमारियों को दूर करने। इनका अच्छा हमको वो मिल रहा है, कॉपरेशन कोऑर्डिनेशन अवेयरनेस में बहुत अच्छा मतलब इम्प्रूवमेंट हुआ है, तो उसके रिजल्ट अच्छे आ रहे हैं।
From the beginning, it was Manas Foundation's goal to open up conversations around mental health.
Mental health awareness campaigns for Manas have been very special and innovative. We have gone beyond just looking into illness, signs and symptoms, but have brought in experiences of people. You will see our specific programs in Dosa or other places. We have gone to religious temples, we have pundits who are there, we have involved them in these campaigns.
The camp initiatives are now supporting communities in 3 other underserved areas. Our 24-hour helpline is another definitive step towards delivering last-mile access to mental health for all. Ours has been a journey of making mental health services accessible, affordable and acceptable for the present and the future generations.
Happy. गुस्सा और सोचना।
We invite you to walk along on this path.
I think the video gave us a lot of food for thought. We now have our honorary guest, Dr. E.K. Singh Rana, Medical Superintendent and Director, ABBIMS and RMN Hospital, to talk about the need for mental health services and the gap with respect to availability and accessibility of these services in India.
I think the top brain which has worked on this Manas Foundation on such a noble cause, I'm really delighted and overwhelmed with their effort. Most of the things about the mental health has been talked by, like hardcore professional related to psychiatry and mental health, as well as the organizers. So I am extremely thankful to all of them for this endeavor. Let me tell you a few things about me. I am a kidney transplant surgeon. So kidney transplant surgeon, talking about the mental health is like a square peg in a round hole. That why a kidney transplant surgeon, what he wants to talk. I was the medical superintendent and director of RML Hospital 2 months back. I had left that office. So I had the horrendous task, or probably the most difficult, most challenging task of my life. Because as a medical student, we had talked about the pandemic like smallpox, cholera, plague. I mean, these are the 3 diseases. As a doctor, I had only, read them in, books. I have never seen a case of smallpox in my life. But yes, I have seen smallpox survivors with pock marks, but not the real patient. So, for the first time in my life, I was entrusted with the responsibility of coping with this pandemic, this present pandemic. So I was the administrative head of my hospital, which is a gigantic hospital, 1,535 beds, one of the top institutions of the country, and it was really basically it was appearing like a fatal pandemic for one and all. And I at never point of time thought that I have got the immunity against time because of this, this pandemic. So I had to cope with. I'm talking to all of you, that means I have survived. There is no doubt about it. So one initiative which I took in my hospital was during that pandemic. We were flooded with the, different kind of, medical support system, ICU, this, that, everything. But we realized that the type of life or the quantity of life that was being lost during that pandemic was phenomenal. Phenomenal means, unimaginable. It was appearing as if the whole globe is going to finish because of that. And, this pandemic was not the kind of illness that will affect only Indian people. Just, it is our response that India is a poor country and this and that. So, mightiest and the richest country in the world, they were engulfed by death. So, because of the bereavement, because of the death, there was tremendous, family were lost. So, a lot of pressure or anxiety or concern were in the mind of survivors. So, what I did was that I started a mental clinic which functioned round the clock in my emergency room, where I had the support of my psychiatrist friend. Psychiatry is a very, very rock solid department in RML hospital. We had the support and we were running this mental health clinic from the emergency room of RML hospital during the whole of the pandemic. We were running it around the clock. The phobia of dying was so much in the mind of doctors also. Doctors never had this feeling that I will never die. Anybody who was committed to the patient care was feeling, threatened, probably my number will also come. But I must compliment, I must salute those professionals who were running the round-the-clock mental health clinic from the emergency room of RML hospital. So I can say that the importance of this problem I was aware about, and little step that I could take in my hospital, I did it. So Banas Foundation and all of these executives, they have taken a very noble and very important task on themselves. Few of the things has already been talked about by the executives and the professionals, secretary friend, he said that there is extreme shortage of psychiatrists, extreme. He is right. If we look at those figures which he just narrated, we would believe that tomorrow if one of us, suffer from a psychological illness or psychiatric illness, probably do we have enough psychiatrists in the country? I mean, one hospital, I can say very boastfully that we have got a rock solid psychiatric department. But what about the country? Country doesn't have. So their endeavor, their drive, ये जो जज्बा है इन लोगों के अंदर में, ये लोगों को जिनको इनकी जरूरत है उसको हेल्प करने के लिए, I honestly salute them. I would like to say only two things. We all know that, one of the panelists, he or she just said, there is a stigma attached to it. Fair enough. There are not one disease which is attached with this stigma. You people must have heard about the leprosy. Leprosy, पूरे फैमिली में शादी नहीं होती थी, या अगर कोई ग्रूम या लड़की की शादी होनी है तो किसी को बताता नहीं था कि साहब हमारे घर में एक और लेप्रोसी हुआ है. So was leprosy. Where is the stigma? None. If you still go to the very rural facts, so they can still say few things. Leprosy is a treatable condition. 6 months to 2 years of treatment, depending upon at what stage of tuberculosis an individual is cured once and for always. So, little bit of change the medical fraternity has done because because the word leprosy was so much, attached to this stigma that nobody wanted to talk about it. So we as a professional, we will never talk in front of a patient from the relative that is suffering from leprosy. We call it Hansen's disease. Hansen's disease, and Hansen was the scientist who, invented or who identified this, this bacteria. So we call it Hansen's disease. So if a rural folks come, you don't have to bother that you will say that he is suffering from leprosy and he'll be bothered or he'll be social outcast. Not done. Hansen's disease. Treat 6 months to 2 years and that's done. The disease is over once and for always. Like tuberculosis. Tuberculosis was TB. TB still carries a mortal fear in the mind of, the people at large. So we, as a professional, we never utter a word in our clinical practice that is so TB ho gayi. We don't say that. Never, not even in the wildest of imagination. We call it tuberculosis. Tuberculosis is a hardcore biological word. It is no more TB. So there is a way. There were many diseases. They had attached stigmata with it, and the society and the people and the science, they have been able to overcome that. So as I narrated about these two illnesses, so mental health, one of the things, I may take a few more minutes. One of the things, it was stigmata. You were absolutely right that you say that he has got mental health. First thing, pagal hai kya? That was the response. Lekin this Bollywood तो इंडिया का बिल्कुल आइकन है, मतलब कोई ऐसा नहीं है. People of Bollywood, the top stars at some point of time, this also, up and down is a, coming and going business. So they also suffer from, some, lean areas of their life. They suffer from this problem and they go to, psychiatrists or psychologists. They get themselves treated, they become all right. So one thing is a noticeable change or a very welcome change, I must say, that gone are the days when Bollywood stars used to shy away from admitting that they have got, tension and this and that. So Bollywood comes out in open, and so much so that I'll not name those top stars. The top stars of Bollywood, real icons, they are on record having said that they have got they had mental health problem, they got themselves treated, and they become all right. So that stigmata, if we look at the top part of the society, that stigma is not attached. There is no doubt. Less a Bollywood star will not say that I had mental health issue, but the real poor people, the villagers, they also have a lot of problems. They have, problem of food, problem of water. So they also suffer from this illness. Unfortunately, like many things, this stigma is still a problem for the, rural areas or less affluent people. Less affluent will also be not the right term. The rural area people. So again, to say a person coming from a rural area that isko to mental health ho gaya, so he will be from next day in his village, he will be labeled as ye to pagal hai, ab to bach ke rehna. So ये स्टिग्मा वाला फैक्टर वहाँ पे है, और जैसा कि जितना नोबल कॉज मानस फाउंडेशन ने उठाया है, तो उसमें इसका रियल रूप तभी मिलेगा when it really percolates to the society, when it really go to the needy people. We have helpline numbers, we have got this number, that number, but nobody is coming for helpline. Then the whole, effort becomes wasted. So the villagers or those kind of people, I think we need to target them, to go to that sector, जहाँ पर कि ये कहने में ना लगे कि आप ये दोनों बोल देंगे ये तो भाई पागल है, वो एक जरूरी है. अब एक मैं डॉक्टर साहब के लिए बता रहा हूँ, मैं जैसा कि मैंने बताया, I repeat, I am a kidney transplant surgeon and I am a square peg in round hole. As far as the secretary is concerned, I am not the right man to say that. But with all said and done, I am a doctor. So, doctor community. I mean, there will be exceptions. I know he has just made a elaborate talk on this topic. But doctors as a whole, and I am sure he will not totally shrug off my concern. Doctors as a whole, they are difficult community. They are very difficult to believe this mental health program. They believe that I have got a problem, I have a psychiatric illness, I go to him, he'll prescribe a number of pills, and I'll be all right. So taking pills, taking injections, medicine is all about taking pills, taking injections, But doctors are very reluctant to admit that. I know doctors who talk among themselves. You just tell him, how about going to a psychologist? He immediately frown. What is a psychiatrist? I'm a psychologist. Psychologists are not doctors. He to professor हैं, उधर पढ़ाते हैं colleges में. They are not doctors. They don't treat. अब देखिए इतना ignorance है हमारे fraternity में. इतना ignorance है कि they are not acknowledged. They are not ready to acknowledge that there is a group of professionals, hardcore professionals, very qualified, rock solid, insight into the problem, who are ready to help people. But the doctors, who are the, as a matter of a vehicle to send patient from one specialty to other specialty, if a doctors, I am not talking about the exception, if they say that यार ये psychologist, psychiatrist क्या करेगा? नहीं, psychologist क्या करेगा भाई? साइकोलॉजिस्ट का तो इसमें कोई काम ही नहीं है. और तो अब बता, डॉक्टर लोग यहाँ तक जाके कह देते हैं, भाई वो तो यही बोलता है कि आपको टेंशन बहुत है ना, आप ऐसा करिए कि टेंशन अपना खत्म कर लीजिए. मैं बताता हूँ, आप डॉक्टर साहब बताएंगे बिकॉज ही इज द रियल पर्सन, तो वो खत्म कर लीजिए. तो डॉक्टर बोलेगा कि यार हम अपना टेंशन कैसे खत्म कर ले, सो बताओ. किसी को पैसे की बड़ी दिक्कत है, रेवेन्यू की बड़ी दिक्कत है, बहुत स्कैर्सिटी में जी रहा है, तो वो अगर बोलेगा कि आप मेरा टेंशन खत्म कर दीजिए, तो बोले वो पैसा दे दो ना, हमारा सारा टेंशन तो पैसे के लिए है, और if you can't give me money, then there is no way I can absolve myself from that tension. So again, this is a group. I mean, I can go on and on this. This is a group, doctors community, except from, of course, like psychologists and psychiatrists, there is no doubt about that. This community is very reluctant to accept that psychiatrists agree, they will agree. But as soon as you talk about the psychologist, that he will listen to you, he will tell you about the insight of your problem, he'll suggest you how to rid yourself on these factors which you are bringing you at the verge of death. You commit suicide. Well, this is the extreme that can happen. This is the biggest illness that can inflict any person. Because which is the biggest illness? That which kills somebody. So again, why I said that the poor community, which I am saying, वहाँ पे stigma, एक तो they don't have really time. जो गरीब आदमी होता है, उसको तो सवेरे उठ करके खेत में चला जाता है, रात को खेत से वापस आ जाता है, तो उसको टाइम भी नहीं है सोचने का, और वहाँ पे ये स्टिग्मा बहुत बड़ा फैक्टर है. और दूसरा जो डिफिकल्ट एरिया है वो है डॉक्टर्स कम्युनिटी का, ये उन तक परकोलेट कराना, which is not going to be an easy task. Let me tell you something very frankly, this is not an easy task. वो तुरंत ही बोलेगा यार तुम एक बार बताओ ना, ये साइकोलॉजिस्ट मेरे को क्या ट्रीटमेंट सिखाएगा भाई, ऐसे बात करते हैं आपस में. I mean, not all this platform like ऐसे ही बात करते हैं. तो इन दोनों को टॉप करिए, मैं इन दोनों को एड्रेस करने में एफर्ट लगाना चाहिए. और जहाँ तक एलिट ग्रुप, बॉलीवुड, ये वो, जहाँ तक सवाल है, ये ग्रुप ऑलरेडी इनलाइटेंड हो गया है. इट इज नो मोर स्टिग्मा फॉर दैट ग्रुप. रोज ना आपको कुछ फिल्म के मैगजीन में आता रहता है कि वो जो थे वो स्टार थे, उनको इतना दिन, तो वहाँ पे स्टिग्मा उस लेवल का नहीं, थोड़ा बड़ा होगा. आई एम नॉट सेइंग यू डोंट डू इट, लेकिन इन दोनों को I'll urge the Manas Foundation and the top executives that the force should be also used on enlightening this community. The gaps are so much, Dr. has narrated, it is so much scarcity to have psychologists and psychiatrists in this hospital. It is unimaginable, lakhs for one person. But I mean, one doctor, how many lakhs you just said that? So that is the gap. So probably the society, the medical colleges, the MCI, the health ministries of, like central and the states, they should focus on it. Why deprive our own people from a treatment which stops them from killing themselves? I will not believe that cancer is a bigger illness than committing suicide. Cancer hardly kills. Gone are the days. There are so many cancers. Like my mother had breast cancer. She lived for 22 years after completion of the treatment. She had no aorta of breast cancer anywhere in her body. She succumbed to her illness. Her age, 76, passed away at the age of 76. तो वो जो है अभी एकदम से इसको फोकस करना बहुत जरूरी है, सोसाइटी, मेडिकल कॉलेज और सबको, कि यार ये, मैं आपको बता दूं, डॉक्टर साहब ने पूरा आप लोगों के पास नहीं डाइवर्ज किया है. अभी मैं बाकी लोगों को, जो नॉन साइकियाट्रिस्ट को बताता हूँ, साइकियाट्रिस्ट आर एंडेंजर्ड स्पीसीज इन दिस कंट्री. आज अगर किसी को यूके में साइकियाट्रिस्ट की नौकरी चाहिए, वो दे गेट इट ऑन प्लेटर. मैं सर्जन हूँ, मैं ट्रांसप्लांट सर्जन हूँ, मेरे लिए तो इतना मुश्किल है घुसना टॉप कंट्री में, मैं आपको बता नहीं सकता हूँ. सो साइकियाट्रिस्ट आर एंडेंजर्ड स्पीसीज. एक समय था when I was the senior specialist or probably a specialist in early faculty in my hospital, whole of the psychiatric department, they moved to UK. Whole with lock, stock and barrel, they never came back till date. So psychiatrists are endangered species. So we need to have more psychiatrists. Dr. Sir has just said, because in one verse certain seats were increased, he got his birth, and now he is a professional psychiatrist in helping people. So probably the society, the ministry and everybody should also help to have more and more psychologists and psychiatrists in our country, because we need it. And I think I have taken much longer time than probably I should have. So I am sorry if I have consumed more time. I am extremely thankful to the organizers, to the foreign guests, to all other esteemed colleagues and friends who are here listening to me. Thank you very much. Thank you.
Sir, I think you beautifully summarized everything in terms of the mental health state in India, and not just the lack, but how people from diverse communities, specifically low resource communities, look at mental health and see mental health as. I think what Monica ma'am said when I went to Gwalior, and the state I saw there was very much alike what Sir said, that a lot of times when we go to these communities, we see that along with stigma, there's a lot of hesitancy towards talking about mental health issues, towards just having conversations around मेरा मन दुख रहा है या मुझे बुरा लग रहा है. And everybody just thinks that they'll be seen as weak, they'll be seen as mad, or they'll be just seen as somebody different than the rest of us. And I think it's very important to address this. With that, I think we have our guest of honor, Srimati Ritu Bhardwaj, director of the show Zindagi with Rija, and former senior creative associate at Amir Khan Productions, to share her valuable perspective on the importance of mental health services in the lives of women. She's been working actively towards promoting mental health and safe spaces to women, and we would be honored to hear her thoughts and reflections about this initiative.
Thank you so much, Veda. I hope I'm audible. सबसे पहले तो मैं आप सबको बहुत बहुत कॉन्ग्रेचुलेट करना चाहूँगी. ये बहुत नीड ऑफ द आवर है ऐसी हेल्पलाइन. मैं यहाँ पे किसी भी एक्सपर्ट या उसके नाते नहीं खड़ी हूँ. मैं यहाँ पे एक मेंटल हेल्थ सर्वाइवर के नाते खड़ी हूँ. मैंने खुद वो फेस किया है और उसके बाद डिसाइड किया कि मैंने जो फेस किया और मैं उससे निकली हूँ और कितना ज़रूरी है उसके बारे में बात करना, वो मैं सबसे शेयर करूँगी. वहीं से जर्नी शुरू हुई थी हमारी कनेक्टेड वुमेन फॉर वुमेन. मैंने कनेक्ट करना शुरू किया. क्योंकि मैं खुद को हील करना चाहती थी, मैं मेरे क्वेश्चंस के आंसर्स ढूंढ रही थी। When I was pregnant second time, मेरा एक बेटा है और एक बेटी। पहली प्रेगनेंसी बहुत अच्छी निकली, उससे पहले करियर बहुत अच्छा था, तो करियर से ब्रेक लिया, पहले बच्चे के लिए बहुत एक्साइटमेंट थी, सब कुछ बहुत खूबसूरत था। लेकिन जैसे ही दोबारा से करियर में आई और अनप्लान प्रेगनेंसी या सेकंड बेबी, सब ठीक था, इन लॉज भी साथ में आ गए थे, बट समझ नहीं आया, सब कॉन्शियस में कहीं शायद था, मैं वो नहीं चाह रही थी जो हो रहा था। और हुआ ये कि मैं एक डिप्रेशन की या एंग्जाइटी की स्टेज में चली। अभी भी मैं नहीं जानती कि एग्जैक्टली मैं डिप्रेशन में थी या सिर्फ एंग्जाइटी में थी, और आज भी मैं ये समझने की कोशिश करती रहती हूँ। बट हुआ ये कि उसका असर इतना ज़्यादा हुआ कि क्वेश्चंस मेरे माइंड में इतने ज़्यादा आए, और मैं कुछ भी पढ़ती रहती थी कि जब आप प्रेगनेंसी में परेशान होते हो, डिप्रेस होते हो, तो कैसा लगता है। और एक स्टेज आई जब 7 मंथ प्रेगनेंसी जो मेरा स्टेज थी, मैं मेरी गायनेकोलॉजिस्ट के पास गई और मैंने कहा मैंने कहीं पढ़ा है जब आप प्रेगनेंसी में इतना स्ट्रेस्ड होते हैं आपका बच्चा स्पेशल चाइल्ड हो सकता है। तो अब तो मैं एक स्पेशल मदर होने वाली हूँ, नाउ टेल मी, आपने तो मुझे कुछ कभी समझाया ही नहीं। सो यू कैन इमेजिन द स्ट्रेस कि एक फीमेल जब उस स्टेज में होती है और उसको समझ नहीं आता, जब उसके पास कोई शेयर करने के लिए नहीं होता, कोई समझने के लिए नहीं होता, सो वो एंग्जाइटी उसको किस स्टेज तक लेके जा सकती है। मैं उसी में थी। और स्टोरी को छोटा करते हुए बताऊँ, आई एम लकी इनफ, आई एम थैंकफुल इनफ कि मेरी प्रेगनेंसी बहुत इजीली हो गई। मेरी बहुत खूबसूरत सी प्यारी परफेक्टली हेल्दी बेटी हुई जो मैं हमेशा से चाहती थी, और उसके बाद लाइफ नॉर्मल हुई। बट वो क्वेश्चंस वहीं के वहीं थे। आई डिसाइडेड कि नहीं, अब मैं इसके बारे में हर जगह बात करूंगी, हर फीमेल से बात करूंगी, हर मेल से बात करूंगी, और स्टार्ट अपने घर से करूंगी। और मैंने वहीं से शुरू किया। मैं पार्क में जब जाने लगी, थोड़ा सा प्रेगनेंसी कुछ समय बाद जब बेटी बड़ी हुई, मैं हर फीमेल से रोक रोक कर पूछती थी। शायद उन्हें शुरुआत में अजीब भी लगा होगा कि अजीब बेटी है, यही बातें पूछती रहती है। बट मैं उससे पूछती थी कि आपको अच्छा लगता है, आप नॉर्मल फील करती हैं, आपका एक बेबी है, 2 कैसा लग रहा है। तो मैंने एक चीज़ नोटिस की, जब बार बार उनसे बात की तो समझ में आया कि बहुत सी जो करियर में अच्छा कर रही हैं वो पहला बेबी करने से भी डर रही हैं, जिनका पहला हो गया वो दूसरे से करने से डर रही है, और जिनके 2 है तो उनकी लाइफ या उनका स्ट्रेस आप इमेजिन भी नहीं कर सकते। और जो अपनी फैमिली लाइफ और करियर लाइफ को बैलेंस करके चलना चाहती हैं, उनके पास अगर सपोर्ट सिस्टम नहीं है तो वो कहीं ना कहीं बहुत सीवियर डिप्रेशन में चले जाती हैं। हाँ, हेल्प कहाँ मिलेगी, कैसे मिलेगी, किसी को नहीं पता। ये मैं मेट्रोज की बात कर रही हूँ। दिल्ली एनसीआर में बड़ी बड़ी हाई राइज बिल्डिंग में रहने वाले हम नहीं समझ पाते। तो आप इमेजिन कर सकते हैं छोटे छोटे गाँव में क्या होगा। कुछ दिन पहले एक बहुत खूबसूरत सी लाइन पढ़ी और मैं सोच में पड़ गई कि इसके अंदर ही सारा जवाब है। काम से होकर लेडी काम पे जाती है और वापस फिर काम पे आती है। आप इमेजिन कर सकते हैं, आप पूरा घर का काम करके अपने काम पे जाएंगे, फिर वापस आएंगे, आपको फिर काम करना है, और अगले दिन कैसे उस काम को वापस से आप अच्छे से मैनेज कर पाए, इसी थॉट के साथ आप सोते हैं, पता नहीं अच्छे से नींद लेते भी हैं या नहीं, और फिर अगले दिन से वापस उसी साइकिल में चले जाते हैं। और कोई आपको इसका जवाब नहीं देगा, कोई आपको सपोर्ट हो सकता है ना मिले। मुझे नहीं पता आप में से कितने लोग इससे रिलेट कर पाए। मैं कर पाती थी एक टाइम पे, बट उसके बाद मैंने सीधा कहना शुरू किया कि मेरी मेंटल हेल्थ का सवाल है, आई नीड सपोर्ट, प्लीज अब आप काम को डिस्ट्रीब्यूट किया जाए। हम लोग मेंटल हेल्थ पेंडेमिक में जी रहे हैं, माने या ना माने। हम लोग सुनना नहीं चाहते, समझना नहीं चाहते शायद, लेकिन हमें इनिशिएट करना पड़ेगा। आपको भी आज घर जाके, अगर आज तक आपने अपनी मदर से नहीं पूछा या उनसे नहीं कहा कि प्लीज मम्मा ये सुपर वुमेन सिंड्रोम से बाहर आइए, प्लीज जाइए अपने घर में अपनी मदर से कहिए, अपनी सिस्टर से कहिए, अपनी वाइफ से कहिए, आपके आसपास जितनी फीमेल्स हैं जाकर उनसे कहिए कि आपको ये सुपर वुमेन सिंड्रोम से बाहर आना पड़ेगा। सब कुछ आप नहीं कर सकती, अकेली बिल्कुल नहीं कर सकती, और करना नहीं है। आप सबको इसमें एक साथ एक लेवल पे आके बात करनी पड़ेगी। और मानस जो काम कर रहा है, मैं बार यही कहती हूँ, हम लोग कुछ नहीं कर रहे। कनेक्टेड वुमेन फॉर वुमेन, मेरे साथ मेरी टीममेट है प्रियंका, ये मेरी सोसाइटी में रहती हैं, मैं इन्हें जानती नहीं थी। कैसे जाना, जब मैंने कनेक्टेड के बारे में या इस थॉट के बारे में कि मेंटल हेल्थ है, ये है, मैं ये फील कर रही हूँ, उन्होंने पढ़ा, उन्होंने शायद रिलेट किया, और उस दिन से आज तक वो मेरे इस मिशन का, मेरे इस जर्नी का हिस्सा बनी हुई है। तो ऐसे बहुत सी फीमेल्स हमारे साथ आई। पेंडेमिक में तो एड्रेस था, एक रात मैं सो रही थी और एक मैसेज आता है मैसेंजर पे अननोन फीमेल का, और मैंने जब सुबह पढ़ा और मैं बहुत डर गई। उसमें कुछ इसी तरह का था कि अब बहुत टफ है, अब सर्वाइव करना मुझसे नहीं होगा। मैं नहीं जानती वो फीमेल कौन थी। मैंने इमीडिएटली उन्हें मैसेंजर में वापस रिवर्ट किया कि प्लीज़ आपका नंबर शेयर कीजिए। आर यू ओके? 2 मिनट बाद एक नंबर आता है। जब हमारी बात हुई तो पता चला लास्ट नाइट उसने 3 बार कोशिश की सुसाइड अटेम्प्ट, बट थैंकफुली उस रात उसकी 1.5 साल की बच्ची जग रही थी। तो जैसे ही वो शायद उस मोमेंट पे होती कि वो स्टेप उठाती, वो अपनी बच्ची का फेस देख ले रही थी, उसकी आवाज़ सुन के वो वापस आ जाती। जब उसने 4th टाइम सोचा कि नहीं अब तो कर ही देना है, उसको कहीं से शायद याद आ गया, उसने कहीं मुझे 2 मिनट के लिए सुना था जब मैंने उनसे कहा था कि आपको प्लीज़ कहीं कोई ना मिले बात करने को तो मुझसे बात कर लेना, मुझे ढूंढ लेना, कनेक्टेड को ढूंढ लेना। और उसने किसी तरह रात में कनेक्टेड को या मुझे सर्च किया फेसबुक पे और उसने मैसेंजर पे डाला। एंड आई रियली थैंकफुल टू गॉड कि मेरी उससे बातचीत हो पाई। और उसके बाद कुछ नहीं किया मैंने। उसका पहला सवाल था कि पता नहीं मेरे साथ ही क्यों। मैंने कहा आपके साथ नहीं, मेरे साथ यही हुआ है और मैं उससे निकल के ही आज आपसे बात कर पा रही हूँ। सो उसके लिए बहुत वहाँ पर एक पहली चीज़ ये आई जो मोनिका जी भी बात कर रहे थे कि इट्स कॉमन, ये एक मतलब कोई रेयर चीज़ नहीं है, इट्स जस्ट लाइक ए नॉर्मल वायरल फीवर, कोल्ड एंड कॉफ। उसका वहीं पर आधी प्रॉब्लम शायद कम हो गई और उसे लगने लगा कि वो आगे बात कर सकती है। तो प्लीज़ यही मैसेज अपने आसपास दीजिए, आप जहाँ पॉसिबल हो मेंटल हेल्थ के बारे में बात करिए, या अगर आपने कभी वैसा फील किया है तो आपको लोगों से वो बात करनी पड़ेगी। वहाँ पर आप पहला ईज आप उन्हें देंगे कि ओके इन्होंने भी फील किया, इसका मतलब मैं जो फील कर रही हूँ वो नॉर्मल है। उसके बाद आप उनसे आगे की बात करिए। और सबसे बड़ी बात जो सर ने कहा था, लिसनर होना बहुत ज़रूरी है। जब सिर्फ कई बार आप बस सुन भी देते हैं ना, वो बहुत होता है। और हम लोग सब आजकल सिर्फ ऑडिटर बनने की कोशिश कर रहे हैं, लिसनर बनने की नहीं। और फौजिया मैम को सुनने के बाद एक ही बात कह सकती हूँ, अगर आप अच्छे लिसनर हैं तो आप बहुत बहुत अच्छे ऑडिटर बन सकते हैं। बहुत खूबसूरती से आप इमोशंस के साथ उन चीज़ों को इसीलिए बोल पाई क्योंकि शायद आप बहुत अच्छी लिसनर हैं। तो मैं बीइंग अ मेंबर ऑफ कनेक्टेड या एक फीमेल होने के नाते, एक मेंटल हेल्थ सर्वाइवर होने के नाते एक ही रिक्वेस्ट आप सबसे करूँगी कि प्लीज़, हम लोगों के पास तो गूगल भी है, डॉक्टर्स भी हैं, सब कुछ है। बहुत से ऐसे एरियाज, बहुत से क्या मैक्सिमम एरियाज जहाँ पे वेदा गई होगी और आपकी मनस की टीम जाती है और भी एरियाज है, वहाँ पे तो मेंटल हेल्थ का मतलब भी नहीं पता है। हेल्थ का मतलब नहीं पता, मेंटल हेल्थ की तो बात ही छोड़ दीजिए। मेंटल हेल्थ को तो हेल्थ का हिस्सा ही नहीं माना जाता। प्लीज़ जहाँ पर भी जब मौका मिले इसके बारे में बात करिए। और वही वाली बात, मैं हमेशा कोशिश करती हूँ कि मैं एक अच्छी लिसनर बनूँ। मैं आपसे भी यही रिक्वेस्ट करूँगी, प्लीज़ बी अ गुड लिसनर। हाय शादिया, थैंक यू सो वेरी मच। थैंक यू मोनिका एंड ऑल द बेस्ट मनस फॉर दिस हेल्पलाइन। डेफिनेटली मेरे पास अब जितने भी लोग आएंगे, जो फीमेल्स आएंगी जिन्हें हेल्प की ज़रूरत होगी, मैं यहाँ ज़रूर उन्हें इस हेल्पलाइन के बारे में बताऊँगी क्योंकि वी डेस्परेटली नीड सच इनिशिएटिव्स, क्योंकि हमारे पास नहीं है वाकई में। आज आप किसी का डोर अपने फ्रेंड का खटखटाइए और पूछिए कि प्लीज़ रेफर सम ऑर्थोपेडिक और पीडियाट्रिशियन और गायनेकोलॉजिस्ट, इमीडिएटली आ जाएगा। एक बार पूछ के देखिए, प्लीज़ रेफर अ गुड साइकियाट्रिस्ट और साइकोलॉजिस्ट, आंसर आपको खुद मिल जाएगा। सो प्लीज़ वर्क टुवर्ड्स दैट। मेंटल हेल्थ को नॉर्मलाइज करना आपके और हमारे ही हाथ में है। थैंक यू सो वेरी मच।
so much Ritu ma'am for your insights. I think आपने जो एक बात बोली कि हम एक सुपर वुमन सिंड्रोम को लेके चलते हैं। Every mother is supposed to be and every mother is expected to be a superwoman, and actually every woman is expected to be that. And I think removing that tag and label from a woman and allowing her to be whoever she is at times, and shedding those layers off and being vulnerable in front of you is super important. And with that, I'm extremely elated to invite our esteemed chief guest, Ms. Shazia Ilmi, member of National Spokesperson of Bharatiya Janata Party, and a very renowned public figure, to come and share her thoughts about this initiative along with her personal dedication to the cause of mental health.
Thank you so much. Thank you so much, Veda. Thank you so much, Manas. I think it's a great intervention, great initiative. सबसे पहले तो माफ़ी मांगना चाहूँगी, आज उस तरह का दिन था जब वाकई में these days we go through it, everything just goes wrong. You take the wrong turn, your driver takes you somewhere, and it's been one of those trying days. I think all of us have them. So I'm very, very sorry about it. मुझे लगता है बहुत ही ज़रूरी initiative है. One of those most important things is something like this we should have had many years ago. And हम लोग अपने बारे में हम लोग ईमानदारी की बहुत बात करते हैं। ये देश बहुत ही धार्मिक है, धर्म के नाम पर बड़ी लड़ाइयाँ होती हैं। और आप जब मुझे इस वक्त देख रहे हैं तो मेरे बहुत सारे टैग्स आपके दिमाग में आ रहे होंगे। जब भी एक दूसरे से हम लोग मिलते हैं ना, तो हम लोग सोचते हैं ये इसकी पॉलिटिक्स क्या है, इसका धर्म क्या है,
ये किस इलाके में रहता है, इसका एज ग्रुप, एज इनकम क्या है, इसकी उम्र क्या है। तो मुझे लगता है हम लोग लोगों को लोगों की तरह देखें, उनकी बातों को सुने, उनको समझने की भी कोशिश करें, बजाय इन सब चीज़ों में उलझें और रूहानियत के नाते, आत्मीयता के नाते उनको समझें। I think that's so important. And I think we've ceased to be ourselves, and I think there is so much of dishonesty with which we treat ourselves. So we're not even honest about ourselves. And this is one issue. And as I was growing up, I realized that there are so much I'm dealing with. Insecurity, anxiety. And I think that everybody I know, and I sense it, that they're going through something or the other. And it's all right not to be okay. It's really okay. But because we wear it and guard ourselves with those armors and those suits, and it's such a disservice we do to ourselves. And I think it's so wonderful to be vulnerable. It's so wonderful to be honest and say I'm scared. I have fears. I don't know where I'm going to go. And this petrifies me. And my hands shake. And I'm nervous. I think, you will not believe it. I've never been dishonest about it. That I have insomnia, that I have anxiety, that I've had stress disorders, that I've been petrified to go on stage. And there has been fear staring at me, that I cry easily, very easily. My niece is there. And she's 17, and Aksa, don't be shy, Aksa. And she is my guardian angel. And मैं अक्सर को रो कहती हूँ, अक्सर what do I do, मेरा full of myself. आप लोग को यकीन नहीं आएगा. और कोई आप सोच सकते हैं कि कोई बड़ी पार्टी का नेशनल स्पोक्सपर्सन कह सकता है, तो कहना भी नहीं चाहेगा. अपनी vulnerability दिखाना नहीं चाहेगा. अरे हम तो लीडर हैं, कैसे किसी को पता चले. लेकिन ये असलियत है. और सब में ये है, पर कोई कहना नहीं चाहेगा इस बात को. तो मुझे लगता है अब इतने लोग हैं वहाँ पे जो घबरा रहे हैं, जो डरते हैं, जो अपने माँ बाप से बात नहीं कर सकते हैं. इतने टैबूज हैं हमारी सोसाइटी में. कल वेदा मुझे बता रही थी ग्वालियर में कितने सुसाइड के इश्यूज हैं. इतने 4 साल में कितने मामले आ रहे हैं. लोगों को समझ में नहीं आता है, फंस के रह गए अपने आप में. एक मखर जाल सा है. They're stuck in a prison of their own mind. Imagine we call ourselves free, but we're not free. There's a cage within you. I'm in that cage. I want to do so much, but I can't because we're stuck. And the eyes watching you, we're always hunted. And those eyes are watching you, they are judging you, they're vilifying you, they're demonizing you. There's the good old social media, which was supposed to really liberate us, which was to make us citizen journalists and give us our voices. But they have muzzled us because there is so much pressure, right? To look a certain way, to be cool, to be woke. They have tribalized us. हम लोग तो निकले थे, हम तो कानपुर के चवनगंज से निकले थे. मुझे शर्म आती थी कि हमारा घर इतना अच्छा नहीं है. मेरी फ्रेंड जो विष्णुपुरी और अच्छे अच्छे एरियाज में रहती है ना, जब कूल लोग रहते हैं, मुझे बहुत शर्म आती थी. मुस्लिम इलाका है, अम्मी बुर्का पहनती हैं, मैं घर में बुलाऊंगी, लोग कहेंगे कि तो माउंटेन एरिया है. You don't know how many complexes I had. And I could not admit it. I won't tell people. I have many brothers and sisters. I was ashamed of it. कि सबकी फैमिली ट्री छोटी छोटी सी होती थी, मेरी इतने ब्रांचेस होते थे. तो मैं झूठ बोलती थी. मैं कहती थी से मेरे क्लोज कजन्स हैं और मैं पेरेंट्स से वो डॉक्टरेट समझते हैं. एंड इवन आई डोंट नो व्हिच वंस आर डॉक्टरेट. क्या बोलती थी, क्योंकि सब मजाक उड़ाते थे. अभी भी व्हेन आई गो हाउ दे आर, ओ तुम तो माउंटेन हो, दीस आर आवर रियल ब्रदर्स एंड सिस्टर्स. तुम्हारी कितनी मम्मीज हैं, तुम लोग क्या ज़मीन में बैठ के खाना खाते हो. इवन व्हेन आई बिकेम, सो इट वाज जस्ट वन ऑफ दोस थिंग्स. We judge ourselves, women judge themselves. We view ourselves, we talk about the male gaze, the patriarchal gaze. But women are looking at themselves from the patriarchal gaze. You've lost a lot of weight. You're looking fat here. Why? Why are we doing this to ourselves? Why don't we celebrate selfhood? This is who we are. Short and fat and tall and thin and old and young. We are beautiful. And you know what men go through? There is such a lot of pressure. So a woman is judged constantly by her youth and beauty, and men from power and money. So men who don't have it and women who don't have the same, do you know what they go through? And it's such a lot of pressure. So this is what we do, and we're cruel as even children now. There is a little gang that gets made. So if we become aware of these things, and you know what? Because we are victims, we overcome some of those things and we become the oppressors. So we have to be aware of it. And I think it's so important to embrace our fears. First, to acknowledge your fears, your insecurity. है यार, डर लगता है, घबराहट होती है, एंजाइटी होती है, नहीं पता, नहीं मालूम, सक्सीड करेंगे नहीं करेंगे, पर हाँ डर तो है ना, अनसर्टेनिटी है, उसको तो रियलाइज करें, उसको ही नहीं करेंगे नहीं, सब कुछ ठीक है, all is well, all is well, नहीं all is not well, and you know something, I'm okay with it. I'm really okay with not being okay, friends. I'm suffering. I'm in a bad space. Positive thinking, positive thinking. कहाँ से आएगी positive thinking? नहीं हो सकता कभी कभी. You're down and out. I go for so many seminars and I'm shocked. I'm the only person in some hundreds of seminars and they keep inviting you, you know. Everybody says, go there with a smile. I don't feel like smiling. I feel rotten to the core. There are some terrible things that have happened in my past. You know, there are times when my older brothers have hit me and I've gone to take exams with a black eye, and there have been terrible crises in my life, and I can't tell you, there's been unspeakable cruelty, psychological and physical, and it hurts me. So I cannot always smile. It hurts me. I want to retain the ability to be able to cry. And it's okay to cry. I'm not going to numb myself to that pain. I will bring it to the public. I will cry, and there's nothing wrong in crying. I don't want to be this courageous superwoman. I don't want to be this superwoman. I want to be a regular person. मुझे नहीं बनना superwoman भैया. आप बन जाओ. सब कुछ perfectly करो. मैं नहीं करना चाहती. I'm okay with imperfections. I'm okay with my flaws. You know, these are the conversations we need to have. And the popular culture has made it so difficult. You have to look perfect, you have to think perfect. There is a death in the family, and you have to deal with it perfectly. No. There's a crisis and everything has to be perfect. No, it doesn't have to be. But what can be done is the attitude towards it, the societal response towards it, the wholesomeness with which you treat it, the empathy. So on a scale of empathy to sociopathy, where do we stand? Do we care? Where do we value empathy? Where do we value care for each other? यहाँ पे तो यार हो गया होगा उसका हम लोग की फिक्र करें. नहीं, हम फिक्र करेंगे. चाहे हमारा नुकसान हो फिक्र करने में, बिल्कुल करेंगे, दिल से करेंगे. लोग हमें बेवकूफ समझे तब भी करेंगे. बेवकूफी is a big value. I score high. हम बेवकूफ हैं. You know, these are the values that must change. नहीं बेटा, इसको बेवकूफ समझा जाता है. शायद तुम तो कुछ ज्यादा ही हो जाती हो परेशान. रहन दो यार, हो जाएगा, कल देख लेंगे. नहीं यार, अगर हमें नहीं फिक्र होगी किसी और की तो क्यों? I mean, I live in a fancy-ish place, and nobody cares. वो सारे सबके जॉब जा रही थी वहाँ पे, जो वहाँ पे स्टाफ बदल रहा था. Nobody was bothered. So unless you become that, how can you make a difference? You know, you can't make a difference to your life if you can't make a difference to someone else's life. This is your homework. आप क्या बदल पाएंगे अपनी जिंदगी में जब आप किसी और की जिंदगी में नहीं बदलाव ला सकते? तो मैं तो कहती हूँ कि लोग सोचते हैं वो बड़े सेल्फिश हैं. मैं तो सोचती मैं बड़ी सेल्फिश हूँ. मैं औरों के बदलाव ला रही हूँ तभी मेरी जिंदगी में बदलाव आ रहा है. तो प्लीज बी सेल्फिश, केयर फॉर अदर्स, योर लाइफ विल चेंज. No, really, it's another way of looking at things. Thank you so much. I'm truly grateful to all of you. Let's take it places. Let's build a bigger campaign. Let's get everybody involved. And this is not your work, this is everybody's work. You don't know how many youngsters, how many adults, everybody needs it. Nobody cares to say it. कोई हिम्मत नहीं करता बोलने की. सबके अंदर अंदर क्या है, क्या घबराहट है, क्या जुनून है, क्या तूफान है. There is a turbulence within each one of us. Each one of us, right from there to there to here to there. It's like a whole. तो आप, मैं really दिल से चाहती हूँ कि इससे बड़ी बड़ी गैदरिंग्स हों, हम लोग सबको लाएं, भूल जाएं पॉलिटिक्स को, भूल जाएं रिलीजन को. हाँ, ये ज़रूर है कि हर मस्जिद में, हर गुरुद्वारे में, क्योंकि रिलीजन का असर होता है, वहाँ पे जाएं, हर पार्टी में जाएं और कहें कि छोटा सा हम लोग एक अपना प्रेजेंटेशन करें. आप जानते नहीं क्योंकि ये रास्ते हैं, ये मैसेज हैं. और मैसेज आपको कहाँ मिलेंगे? आपको पॉलिटिकल एरिया में मिलेंगे, आपको रिलीजियस एरिया में मिलेंगे. वहाँ पे आप जाएंगे और इसकी हेल्पलाइन की बात करेंगे. ये एक्सेस हम लोग आपको प्रोवाइड कर सकते हैं क्योंकि ये बहुत बड़ी बड़ी संस्थाएं हैं ना, इदारे, बहुत इंस्टीट्यूशंस बहुत बड़े बड़े हैं. तो आप लोग मस्जिद के खुतबों से बात में जाइए, जहाँ पे बाकायदा मौलवी बात करता है, गुरुद्वारों में जाइए और मंदिर में जाइए. पहले किसी कोई बात हो रही है, कोई जागरण हो रहा है, छोटी सी आप अपनी एक मैसेज कीजिए और वहाँ पे आप देखिए, आपको लोगों तक जाना है. मेरे शेर वो खवास पसंद, लेकिन मेरी गुफ्तगू आवाम से है. मजाज का एक शेर है, ये बहुत फेमस शायर है. तो बात तो बहुत ख़ास है ये, लेकिन गुफ्तगू तो आवाम से है ना. और सब लोग चाहते हैं कोई उनसे बात करे. ना माँ से बात कर पा रहे हैं, घबराहट है, ना वालिद से, ना पिताजी से, भाई बहन से नहीं. इतना टैबू कर रखा है बुनियादी चीज़ों की बात करना. लोगों को समझ में नहीं आता है किससे बात करें. और हैं ख्यालात आते हैं, सुसाइड का आता है ख्याल, अपनी जान लेने का, जिंदगी खत्म हो जाए, ऐसे हैं ख्यालात आते हैं. एंड इट्स ओके टू हैव देम, बट पीपल जस्ट लाइक, oh, this, they criminalize those, they demonize those. The person is just shut up then. Where do you go? So there has to be a way. And so I'm deeply honored and thankful and humbled that all of you are angels. I'm so shukr-bazar, and that all of you thinking of that, you young stars are guardian angels. Please do more, always at your service. Everybody from every religion, party, sect will be there to serve this noble cause. So thank you so much.
Thank you so much, Adya ma'am. I think आपने बहुत ही honestly और vulnerable होके बात करी है, जो आसान नहीं होता सबके लिए. It's not easy to shed layers and talk about everything that you've been through, and it's not easy to get teary-eyed in front of people. And I can vouch for that. It's not easy. I'm extremely glad that you came here and you spoke about this cause, and I'm extremely glad you told us the channels to access, religious places, political party places, everywhere we can go and we can, address the cause of our helpline and talk about the availability of our helplines. And I would request everyone to, if ever you feel sad, depressed, stressed, anxious, you feel like you're not doing okay, just call 080-6909-6909. That's our helpline number. We're nationally now functioning. Anybody can call and access us in Hindi and English languages. And I would thank all of you for being here and supporting our cause and the launch of this helpline. Thank you so much. And let's just proceed for lunch. Thank you.